Thank you very much, David. What a great day today. I'm overwhelmed. I mean, when you think about the era of opportunity we're living in now in healthcare, and you think about the amazing opportunities before us, artificial intelligence, immunotherapy, changing logistics so care becomes equitable and fair for all, deep learning, the list goes on and on and on, and it's overwhelming. And what is, to me, even more overwhelming than the opportunities we face, but it's the responsibility that we share to make some really important decisions. Because we're living in a present that has predicted a future that's imminent, that's coming. Change is coming. And people are going to look back at us one day and judge us by the priorities we set, the strategy we put in place, and what we do when we leave this room. And it's significant. So I'm a neurosurgeon, recovered. I don't do it anymore. I'm a recovering neurosurgeon. And I'm also a scientist. And so I think it's useful to challenge ourselves in a first principle kind of way. Like, what metrics will we be judged against? Well, a very simple way I like to think about it is, what's the opposite of health? Death. The extreme opposite, the extreme failure of healthcare would be death. In the last 75,000 years on the planet Earth, 110 billion people have been born. 102 billion of them died. There's about 8 billion people left on Earth today. 80% of those people, in that 102 billion people who died, 80% died of infection. Died of infectious diseases. Since the scientific revolution, that problem is solved. Why do I say that? Because today, 60 million people die every year, and 40 million of them die of diseases like cancer, heart disease, stroke, neurodegeneration, Alzheimer's, diabetes, metabolic syndrome. 40 million of the 60 million people on the planet Earth today are not dying of infectious diseases. We've increased, by solving infectious diseases since the scientific revolution, we've increased lifespan from 30 years old to whatever it is today, 75, 80 years old. Think of that. So that's one way that people are going to look back at us someday on how did we do? Did we solve these problems at a global level of big numbers affecting large groups of society, including some of us in this room? That's one way people will look at us. But the other way is much more informative for many reasons. Because in every one of those cases where an infectious disease was eradicated and the scope, the trajectory of the human race was changed, in every one of those cases there was a first patient. So does anyone know who this is? I mean, it's cheating because his name is on the picture. It's from 1885. It's Joseph Meister. Joseph Meister was 9 years old and was bitten by a rabid dog. And until the day that Louis Pasteur vaccinated him, every human being who ever contracted rabies before 1885 died. Now, most of us leaving this room today, and those of you at home watching virtually, are not particularly worried about crossing the street and getting accosted by a rabid dog or a rabid squirrel in the driveway. But before 1885, that was a real concern. And so wherever we think of these sweeping changes in healthcare that is our burden and our opportunity now, there's a real person involved. Some of you should know who this is, this nice family, very handsome family. The guy in the middle invented the vaccine that eradicated polio. That's Jonas Salk. And he's also the first patient, because he inoculated himself first. Then he inoculated his wife and his 3 boys. So we can go on with stories of first patients in infectious diseases as no longer being the major threat today, and we can take it all the way up to this patient, who many of you know, actually. Many of you know. That's a clue for those of you who don't remember who she is, because Michael was there the day that Sandra Lindsay was the first person vaccinated against COVID in the United States. So I'm not saying the infectious disease threat has been eliminated. It hasn't. But it's not the major challenge to the survival of the human species. Inflammation, underlying those other killer diseases I listed, is a major therapeutic opportunity. And that's where at the Feinstein Institute and at Northwell, we have invested a lot of work and put a lot of human capital and a lot of brilliant minds on trying to solve that problem of inflammation. And it's really exciting to look at opportunities that are coming because some of the discoveries have led to the idea that it's possible to target the nervous system using microchips, implantable computer chips, on nerves in the body, including the vagus nerve. And this is, some of you know this woman too. This woman is named Kelly Owens, and for 15 years she was crippled by Crohn's disease, in and out of wheelchairs, having gone on and off 22 different medications at the expense of millions of dollars, all to no avail. She suffered, she suffered, she suffered. I have pictures of her in the hospital, and she doesn't look like this, but she went into a clinical trial by Set Point Medical, a company that spun out of the Feinstein Institute that I co-founded. She's now wearing a vagus nerve stimulator, which has put her in remission from inflammatory bowel disease because of this bioelectronics. And she is a first patient. And she is alive and well, and she's worked with us very closely as a patient advocate for many years. I have to tell you, I struggled making this slide whether or not to put remission or cured. But she has been implanted for 8 years, she has no symptoms, and she takes no medication, so I went with cured. So these are amazing stories, and they continue to get better, and it's very important that we remember these human faces on these incredibly important decisions that are going to cost millions and millions of billions of dollars by the time it all plays out. But there's one more, and he's here with us today. And this is Keith Thomas. And Keith is a willing participant in a clinical trial, and you're about to meet him. And he is the first person ever to be able to regain motion and feeling, despite the fact that he was rendered quadriplegic. But because of the work that's going on now, you're going to hear an amazing story. So we're going to start with a movie, and then Keith and Chad Boughton, who's leading this research program at the Feinstein Institute, will come up on stage. The movie, please.
It was a nice day. It was July 18th, 2020, and we were just hanging out by the pool, and I went to dive into the pool. So I dove in aggressively as usual, and then I just blacked out. Next thing you know, there was a helicopter on the front lawn. And the next day I couldn't even move. Then October 2021, I met Chad, and they approached me about joining the study.
When we met Keith for the first time, he was not even able to lift his arms off of his wheelchair, and he was not able to feel anything in his arm and hands either. After Keith was enrolled into the study, we performed functional MRI, and this allowed us to view the motor and sensory areas of Keith's brain, and it allowed us to really pinpoint where we needed to implant both the motor and sensory electrodes.
After opening the skull and opening the cover of the brain, we then got out a stimulator. We had a pretty good idea where the hand areas were going to be, and we stimulated them directly.
You feel the thumb?
It's in the thumb?
Yeah, you think.
So I placed it right over one area, and he said, I feel my thumb. I said, what part of your thumb? He said, my thumb tip, the inside of my thumb tip. And I said, oh, we found it. At that point, we brought in the actual device, mounted it onto the skull, and then used these wires to gently lay them without damaging them, and place them precisely in those 3 areas that felt the fingers, as well as the 2 areas where we knew that his hand motor function was.
So Keith's brain is literally connected to a computer. There are signals from his motor area responsible for movement going to the computer, and signals from the computer are going back to different stimulation points in his body, brain, and spinal cord. And the goal is to restore movement and the sense of touch in a lasting way.
But I like to see an actual person, like a family member, touch you and feel them. It's different.
Since Keith has started the trial, he has gained over 100% in arm strength, and he's already starting to feel sensations in certain parts of his arm and even wrist. We have started to see some lasting new sensations in his arm that are present even when we turn off the bypass. For me personally, this is an incredible moment. For years, we have been wanting to really tackle the restoration of movement and the sense of touch and bring those together. And we've also wanted to create lasting effects. I think we're going to continue to see progress, and I think it'll be applicable to the millions of folks around the world that really need this technology.